Hi, welcome to Little Growing Bonds. My name is Judith Nasazi. I'm a children's bond doctor. Today we shall talk about flat feet. At the end, I'll answer a few commonly asked questions about flat feet, so stick around. YouTube about how to take care of children's bones. So first off, what is a flat foot? Well, a flat foot is where the inner side of the foot or that arch actually touches the ground when someone is standing on it. In this case, we're talking about children. So when they stand, that inner side of the foot touches the floor. So flat feet are very common. I think if I'm making a random estimate, I see about maybe 4 to 5 children every week with flat feet in my clinic. They come in because the parent is very concerned or just because someone mentioned it, and they're very concerned about the appearance of the foot. You may wonder why very many children have flat feet. It's very common in children, and this is because children typically have very stretchy, very lax ligaments. Therefore, when they stand, these just stretch out and are in contact with the floor. It's much more common in infants, but as the children grow, this tends to change and the arch forms. What are the causes of flat feet? Well, like I mentioned, children are very flexible, especially babies. Therefore, that stretchiness contributes to them having flat feet. Okay. The other reason is it can be genetic. So if someone in the family has flat feet, then there's a high chance the children can get it as well, especially if it's a first-degree relative. In some instances, it can be because of weakness of the muscles. Okay, that's very rare in children though. And sometimes you just don't know, and someone just has flat feet and we don't know how it came about. There are 2 types of flat feet that I like to point out. It can be a flexible flat foot or a stiff flat foot. So the flexible one is the one that's more common in children, and how do you know it's flexible or stiff? So the exam I do in the clinic is I tell the child to stand on the tippy toes. So when they're standing on the toes, you'll see that the arch reconstitutes, or if they're not standing on the ground, then they're in a seated position, or they're lying down, when you look at the bottom of the foot, you'll notice that the arch reconstitutes. So that is a flexible flat foot. The stiff one, however, when they stand on the tippy toes or are not, weight bearing, that arch still won't be present. Do I always do an X-ray for a flat feet? Very rarely, except if the bottom of the foot is a rocker bottom. There's a condition called vertical talus that presents with a rocker bottom foot, and that is a variant of a flat foot. In that case, I'll get X-rays, but it's rare that an infant will be brought in with a flat foot and I'll get an X-ray done, unless they look a little peculiar, but that's a story for another time. This will actually lead us to the other variants of flat feet. Typically, when I do a clinical examination, it will help me know, feel that foot and know if it's one to worry about or one that is, a straightforward flat foot. And that guides on if I do an X-ray or not. If you're enjoying this video so far, please give us a thumbs up, or don't forget to subscribe as well. Thank you. So how do we treat flat feet? Well, in babies, I typically just observe. It's very important to educate the family about the children and how the flat feet resolve as the child grows. I encourage the kids to play, to just be kids, and just enjoy their life. There's very little role. In fact, I rarely send them to physiotherapy or have them braced when I'm dealing with these feet. Often they will correct with or without the braces, and therefore I advise the parents about that in that regard. Okay. When should you be worried though? Well, flat feet, I don't worry. I only start to have concerns if a flat foot is painful. Okay. This can come from a few things. One of those can be things like an accessory navicular. This is a condition where someone has an extra bone on the inner side of their foot. So when they stand and put pressure on the bone, it causes them pain. This is often seen in relatively older children, so 8 and over. The other condition that can cause pain is called tarsal coalition. This is where an area that is meant to be a joint actually stays fused, okay? And therefore, when an area that's potentially supposed to be a joint is fused, when you attempt to move it, it can be painful, okay? And but if you want me to make a video about this particular topic, which is pain in the foot or pain in flat foot, please just let me know in the comments below and we can work on that, okay? Now gets to the interesting part. There's some very common questions asked when it comes to flat foot. One of those is, are flat feet bad? Simple as that question may be, it's something I hear very often. So I will borrow a phrase from one of my mentors, and he always told parents that feet are like eyes. Some are green, some are blue, some are yellow. Well, maybe not yellow, but brown. And their job is to see, right? So like the feet, their job is to stand, right? And if they are there and they're doing their job and they're painless, then that's okay. So it's not that flat feet or arched feet are better than the other, okay, and vice versa. If you're walking and you're pain-free, then they're doing their job, and then that is fine. So I don't support the whole this foot is better than the other, okay. Do children need special shoes for flat feet? I rarely prescribe any special shoes for children with painful feet, and that is different, however, for painful feet, okay. And based on the age at which you see the child, in sometimes braces, I'll give a medial arch support, okay. But then again, we can also have a different video talking about just that. Are flat feet a sign of bad luck? There are very many cultural beliefs here in Uganda around flat feet. I know lots of people with flat feet who seem to be doing well in life. So I honestly believe that it depends on what you believe, okay? If you believe that nothing is wrong with your foot and this is just something people say, then, well, yeah. But if you believe otherwise, then I believe your life could also turn out that way. Do flat feet get better? So children's feet go through changes as they grow. Like I mentioned earlier, the arch will typically be present at about 7 to 8 years. Some people much earlier. And after that, the chances of it forming are relatively small, okay? So there's a high chance that foot might stay flat. Is walking barefooted better for foot development versus wearing shoes? Walking barefooted is good for foot development, but remember to have the children wear shoes when they are outside to protect them from skin trauma, okay? So that's it for today. Thank you for watching. Look out for our other videos. Also, if you like this video, please subscribe and give us a thumbs up, and so you can be the first to know when we publish. Thank you.